Hello. We Aspire is very fortunate to have a very well-renowned andrologist, male infertility specialist for a special podcast today on the topic of sperm selection techniques. With us is Professor Ashok Agarwal, who is the founder and president of the Global Andrology Foundation, and the former director of the Andrology Laboratory and Reproductive Tissue Bank, and director of research and training at the American Center for Reproductive Medicine in Cleveland. And Dr. Agarwal has trained over 1,000 researchers and has lectured to more than 10,000 scientists, clinicians, and students from 130 countries. And listen to this, he has an H index of 135, the highest I've ever seen. We are very fortunate here to have this short conversation with Professor Agarwal.
Thank you very much, Professor Novero. It is my pleasure and honor to be with you, but also to be invited by Aspire to participate in their prestigious meeting. I'm so happy that I came, and it has been a great experience over the last 3 days.
Okay, thank you. We'll get on with the interview on the topic of sperm selection. So, my first question, Professor, would be why is sperm selection such a critical issue in the ICSI that we do today?
Thank you very much for your question. I believe we can answer it in several ways. First of all, ICSI is considered a process or a technology which skips or really bypasses the natural selection procedure which is established in natural female reproductive tract. So because of that, we believe that the success of ICSI hasn't risen dramatically over the years in patients with severe male factor infertility because the ICSI is not filtering the sperm which have functional incompetence, which have molecular abnormalities and defects that are not something which can be selected by a routine ICSI procedure. So I believe that it is extremely important in order for us to improve the success rate of ICSI for severe male factor infertility, for which primarily ICSI was invented, but now it is used for a variety of other indications. We need to look at ways where we can supplement ICSI with some techniques of advanced sperm selection that will help improve the rates of success of ART in terms of various events that happen after the ICSI has been performed, embryo development, whether it is pregnancy, whether it is live birth rate. So there are so many aspects of ART outcome which can be improved, and overall we can improve the success for our patients who are suffering from infertility and have severe forms of male infertility and which are going through ICSI.
Correct, because ICSI bypassed a lot of barriers.
Correct.
So we will try to restore some of those barriers by getting better sperm.
Correct.
Okay, my next question will be, how does natural sperm selection differ in the female reproductive tract, differ in what we do with ICSI in the laboratory?
That's a very important question. And I think if you look at the female reproductive tract, there are various points at which the sperm are filtered. from uterus all the way through fallopian duct to fallopian tube to various checkpoints where sperm that are coming in billions are filtered, and only few thousand sperm are able to reach the site of the egg.
Okay.
And those checkpoints are not just filtering the sperm or selecting the sperm, which are phenotypically most normal in terms of their motility or in terms of their morphological look, but they are also looking for sperm which are having the most uh, functionally normal spermatozoa,
Yeah.
whether it is intact DNA, whether it is intact genetic integrity or capacitation enzymes. So there are a number of properties of the sperm that allow these checkpoints to permit the most competent, most functionally normal sperm, while the ART techniques that are being used, either they are conventional techniques which are density gradient or swim
The
up
swim up.
or washing and resuspension, are essentially concentrating the sperm, or they are filtering them or improving their motility or improving the morphology. But what they are missing are selecting the sperm for their functional competence. So one of the thing that is missing is that we know a lot is sperm DNA integrity. So the sperm that are selected by various technologies that are being used uh, do not allow the most normal sperm from a DNA integrity
Correct.
point of view
Correct.
to be selected. And that is one of the reasons why we are seeing higher rates of miscarriage, recurrent pregnancy loss,
Correct.
and failure of embryo development in patients who have severe forms of male infertility and who are undergoing ICSI.
So we really need to get the best possible technique to select
Absolutely.
the best sperm.
Absolutely.
Okay. So do conventional sperm selection methods like what you just mentioned a while ago, swim up and density gradient, do they actually improve outcomes in ART?
Well, they perhaps could improve in techniques which are not considered ART, like IUI,
Yes, IUI.
but and maybe to some degree in vitro fertilization. But when it comes to ICSI, I don't think they really are capable of improving the functional competence in severe cases of male infertility, because
That's correct.
ICSI is for those cases. If the sperm samples are normal, then you don't need ICSI.
Correct.
So I believe that those conventional techniques are incapable of improving the most critical parameters of the sperm. And I'm going to focus on sperm DNA because that is universally accepted and where we have the guidelines from the professional societies. But in addition to the sperm DNA, of course, there are scores of other molecular markers or aspects which are available and are known to us from a research point of view, but are not tested routinely, and we don't have a lot of clinical data in support of them.
Okay. So now we've talked a little bit about sperm DNA fragmentation. So let's start talking about that in a deeper sense. So how important is sperm DNA fragmentation or SDF in determining ART success?
I believe it is the most important
Okay.
determinant of ART success. In my talk just short while ago, I showed several meta-analyses which are based on large number of clinical trials that have been published, and there are many meta-analyses that have shown that sperm DNA fragmentation damage is directly related with failures in IVF, failures in terms of ART outcome, poor embryo development, poor implantation, poor success with pregnancy, poor success in live birth, and even in ICSI, we see high rate of miscarriage and
Okay.
also poor live birth in patients who are undergoing ICSI with high sperm DNA fragmentation. So it is a compelling evidence that is being accepted by scientific community and clinicians that the integrity of the sperm DNA by any number of methods that are available, despite it being not very well standardized as a test, still is the most significant development of the 21st century
Mm.
and is directly correlated with ART outcomes. So this, I believe, based on the literature, based on the evidence that we have, based on the professional society guidelines that we have, is absolutely important for ART outcome.
Okay. Now let's talk about one of the techniques in sperm selection that's really gaining attention in recent years or even decades, and this is microfluidics. What does the amount of evidence in microfluidics say right now? How acceptable or how valid or how useful is microfluidics right now as a technique in selecting good sperm?
It's a very good question. And microfluidics, among so many other techniques which are available to select the best sperm, and these are called advanced techniques for sperm selection. Unlike the conventional techniques which we discussed, like swim up and density gradient, there is a list of techniques,
Yeah.
including magnetic cell separation, PIXI, and electrophoresis, and so many. But if we can put our finger on one of them, that will be the microfluidics. We know a whole lot more about this technology because there is a lot of science behind it, a lot of clinical evidence, a lot of clinical studies, meta-analysis, which show that the results of sperm separation or sperm selection by using the microfluidics is providing sperm with lower amounts of sperm DNA fragmentation. It does not completely remove sperm DNA fragmentation, but it significantly reduces
Very good.
that, in addition to improving other attributes of the sperm, such as morphology and motility, etc. The only drawback is that the number of sperm is reduced. But for ICSI, I think it's an excellent technique with excellent results, which seem to suggest at this time microfluidics is a technique that can be used for patients with high sperm DNA fragmentation subjected to ICSI.
That's very good to hear. At least one of them works quite well based on recent evidence. There's another one that comes into the picture. You hear it once in a while, called magnetic activated cell sorting, or others call it MAX.
Correct.
So, does MAX also help as a technique in selecting sperm?
Correct. I think we did a lot of basic science work in the beginning to popularize this test or this technique about 15 years ago. At that time, there was no research on these paramagnetic beads.
Yeah.
Um, yes, there is a sizable amount of data, clinical data, and meta-analysis which show patients who have high sperm DNA fragmentation uh, reduces by using the magnetic cell separation, because it selects the apoptotic sperm
Yes.
and allows the passage of sperm with which are non-apoptotic or have low sperm DNA fragmentation. Now, there are some caveats about this technology. The advantage of this technology in terms of the outcome are not so well spread out
Okay.
for all categories of patients with DNA damage. It's much more identified with patients with high, very high sperm DNA fragmentation. Point number two is that this technology has some safety concerns. It has not been approved for human IVF related techniques in the United States. I'm not aware of its status in Europe, but it is definitely something that has not been approved. So it cannot be legally used for patients undergoing ART, and because of the concerns that the magnetic beads can pass through during the separation procedure and can lodge itself in the egg or in the embryo, and it can have some kind of harmful effect, because there are no safety studies that has been demonstrated by the company or in the literature about these particular beads that are being used to create magnetic cell separation.
Okay, so those are most of the current techniques. Now, I'd like to take a look a little bit to future techniques, and this would mean it would suggest the use of AI or robotics. How does the future look like in sperm selection using these two technologies?
Well, I think you have asked the most important question, and the future looks good. We have seen promising uh, results with the use of both AI and robotics in terms of savings of time, repeatability of procedure, which reduces the fatigue and mistakes, which is something where robotics can play a role. AI, where we can really find the right sperm by using native semen sample without any kind of staining. There are already studies which demonstrate that AI can be used to identify, select, and separate the sperm with the use of in conjunction with microfluidics. So I believe that the future is really exciting. Perhaps if you will be interviewing me next year or 2 years from now, I might be having some data which demonstrates that AI and robotics and other technologies like nanotechnologies can be complemented with our advanced sperm selection techniques such as microfluidics to provide results which are superior than anything that we have seen here right now. They are reproducible, they are accurate, they are precise, and they can be done faster. Something which really I think we would like to dream about. But I believe that it is completely possible that it will become practical.
And we look forward to that. Unfortunately, we don't have much time, so I just like one more question to ask you. How could you please summarize for our aspire clinicians? What do you think would be the best techniques that really work for sperm selection?
Well, based on the current data, current evidence that we have, I will put all my trust in microfluidics
Okay.
as one of the best technology which can help reduce significantly sperm DNA fragmentation. Now, I would think that in the coming days, we'll have the use of AI and robotics that will allow us to use those technologies to do this procedure in conjunction with the microfluidics in a much more accurate, much more precise, reproducible manner, and also perhaps be able to do it, the use of those sperm later on for ICSI without any form of damage to them. So I think there are uh, microfluidics complemented with the AI, but also AI by itself in native sperm is a much more upcoming technology that we see, which perhaps will allow us to select the sperm, especially in cases of non-obstructive azoospermia, perhaps, where we really need only very few sperm, and there are only very few sperm in those cases which are going through microtesy. So I think the technology is really promising, and I'm really optimistic that we will see revolutionary changes, just like microfluidics is now at this stage, something which we can vouch to be very useful for ART success.
Professor, I wish we have more time, but for now, we will have to do this. We're very happy and thankful that you were able to share your expertise and time with us. Thank you
Thank you
very
very
much.
much. Thank you. Really appreciate. Thank you.